And welcome back. I'm Mabel, Jong. This is live coverage of the World Healthcare Congress here in Washington, D.C. And in our studio, we have President of the Healthcare Leadership Council, Mary Grealy. Mary, great to see you again.
Nice to be here. Thank you.
Well, it's really great to have a check-in with you every once in a while to see where we are with engagement and with data and so forth. Are you encouraged by what you're seeing on the engagement front from consumers?
I'm very excited, and I think we are finally aligning the incentives between the patient and the providers and the payers as well. And we're becoming a much more patient-centered healthcare system. We really can't make the changes we need to make moving to a value-based healthcare system unless we have the patient or consumer engaged and helping to better manage their care, and I think more importantly, better manage their health before they get sick.
Well, how do you see that? What are you seeing that's so encouraging?
I think what's really encouraging, we've seen this movement among employers for quite a while now, doing wellness and prevention programs with their employees. And I have to say, many of them thought, I'm not really going to see the return on this investment anytime soon, but I know it's the right thing to do for my workforce. Well, the good news is they are seeing the return on the investment. More productive employees, healthier employees. And really, by targeting those that might have chronic conditions like diabetes, they can make an immediate difference, both in the quality of their health, but also the cost of the health.
Are you seeing enough support from the government side and continuing to make these programs stronger?
Well, the good news, and you don't really hear much about this, but we did have a very significant piece of legislation passed called the Chronic Care Act. And it really will make changes in the Medicare program, Medicaid programs to help promote healthier lifestyles, more telemedicine, just a lot of tools that we can use to better manage and engage patients and consumers.
Well, it's hard to talk about chronic care without addressing also the crisis that we have with painkillers and addiction. So where does the Leadership Council stand on that front, and what are you seeing there?
Well, I'm so glad you asked me about that. We represent all the different sectors of healthcare. So we have manufacturers of pharmaceuticals, medical devices. We have payers, the health plans. We have providers, many of the renowned healthcare systems. We have called upon all of our members, and we're reaching outside of our membership to hold an opioid summit on May 14th. And we've developed 3 work groups leading up to that to see if we can come up with actionable consensus recommendations on how we can address what are the best practices in opioid care management and therapy, how can we use data analytics and technology, and what are the most innovative therapies. And looking at all of that, getting that work and recommendations from those 3 work streams will bring together both the private sector and the government to really make recommendations coming out of that summit.
Are you sensing from your membership that pharmaceutical companies are as strongly at the table as other stakeholders in this area are?
Oh, I would say they are leading the initiative. And alongside of them, I must say, I don't think I can remember a more positive response to an initiative and more engagement by our members on an initiative than we're seeing. And I think part of it is that they feel as healthcare leaders, they have a responsibility to address this crisis. And their employees are asking them, as healthcare leaders, what are you doing about this crisis and how can we help? So it's our pharmaceutical members, it's our providers, and it's also the payers that are going to play an important role here as well.
What other messages are you leaving with people that you're meeting at this meeting this time?
Well, that we are on the track to a value-based healthcare system, but I think the single most important thing, and we've been working on it for years because of our diverse membership, breaking down the silos and having much more collaboration among the different sectors. We really can't get to where we need to be to a patient-centered healthcare system based on getting better outcomes at a lower cost unless the payers, the providers, the manufacturers are all working together.
Okay, Mary, and how are you finding the conference so far?
Well, it's great. I mean, the opening panel really resonated that message. And we're also hearing a lot about social determinants and really addressing how we don't just look at clinical care, but at the whole patient, the whole consumer, in trying to deliver that value.
All right, Mary Grealy, thank you so much for your time.
All right,
Appreciate
great to
it.
be here. Thank you.
And I'm Mabel Jong. Thanks for watching. We have many more interviews to come.